Developing news this noon, nurses at Albany Medical Center are once again voicing their concerns about what they call unsafe and unfair staffing practices. As you know, we've been covering the story for many months now. Our Steve Cooge was at a news conference this morning. He joins us now live with reaction. Good afternoon, Steve.
Good afternoon to you, Caitlin. Here's what it really comes down to. Nurses here at Albany Med say they currently have about 1,600 nurses, give or take, any day working here. The problem is they have 600 open positions for nursing that they need to fill. Without that, the nurses union says they are in a dire situation right here. And these demonstrations that they're waging out here in front of Albany Med are as much for them as it is for all of you, all the patients they have who depend on their services. That demonstration was taking place right out here in front of Albany Medical Center just moments ago. The nurses say they're trying to bring awareness now to a significant number of repeated violations that are happening here at Albany Med Center. Let's take you over to our video. The nurses union has accused Albany Med of what they say is violating New York State staffing laws at least 50 times. So you might ask yourself, how does that affect all of us patients? Well, examples of these violations include exceptionally long wait times in the ER, wait times of several hours or more, neonatal nurses taking care of up to 5 newborns at a time when the limit they're supposed to have is only 2 infants. The staffing levels for nurses do vary by department, but the nurses union says overall, many of their nurses are juggling 50% more patients than they should be because of how low staffing numbers are currently. They're accusing hospital administrators of trying to keep what they call a, quote, staffing crisis a secret by not bringing awareness to it. Nurses at Albany Med, they began their demonstrations in August after their contract expired in July. They're trying to get this all fixed up. They're asking the hospital to hire more nurses so they can create safer conditions for everybody. Take a listen.
Nurses say Albany Med's nurse vacancy rate is 25% compared to the national average of 10%. It shouldn't be a surprise that Albany Med has some of the highest emergency room wait times in the country.
And aside from that wait time, we're also hearing they're having a high turnover rate. So not only are patients having to work longer, but more nurses who are coming here, or even some of their veteran nurses, are deciding to leave to go elsewhere. And if that continues, Caitlin, the situation, they say, is just going to get worse. Now, on the flip side, hospital administrators here at Albany Medical Center, we are set to be having a press conference with them in about 30 minutes or so. We're going to head on in there to get their side of the story, to see why both of these two sides just can't come to an agreement. Because, again, as we mentioned, in the end, it's all of our health care that's at stake here. Caitlin?
All right, Steve, thank you so much for those updates. Of course, very important topic, and we'll continue to follow that for you.